Thank you for tuning in to watch our Invest Raleigh-Durham launch conference. You're about to watch panel number 1, Managing Disruption, how education and healthcare professionals are managing technological disruption to improve outcomes. Enjoy. Welcome, welcome, welcome. So panel 1, Managing Disruption, how are educators and healthcare professionals navigating technological disruptions to improve outcomes in both fields. I'm really excited for our discussion today. I have some wonderful panelists who are going to be sharing some amazing commentary today. And who are my panelists? We have Steve Lawler, President and CEO of North Carolina Healthcare Association. We have Maha Lund, the Dean of School of Health and Sciences at Elon University, and Curt Ladig, the President and CEO of Delta Dental of North Carolina. So I guess to the warm-up question, I'd like to throw a question out to every one of you. Healthcare, we're going to talk about a lot of healthcare, we're talking about a lot of education, how they are intertwined. So just to bring it back to college, if you were to redo college, what was a lesson that you learned afterwards that you would do, that you would change if you were to go back to college today? You said you want to start. There's another slide for one. And
Good. Yeah. Right. So probably stay already. I think that would be first and foremost. I would say that just really appreciate the importance of teams. So many times, and I have to admit that growing up in Greenville, and I reconnected with a new friend, Pam Willard. We both went to Rose High in Greenville. But I went to a military college, so my experience probably a little different. But really just understanding the importance of team, because once you're done, everything you do from that point, you're part of a team. So I think it's just really understanding, the power of how, groups of people can work together to get things done.
Yeah, for sure. The flip button. That's the thing.
I sure.
Much higher than we have on the bottom. I'm a bit out of that. But that's an excellent question. So my background, I started in liberal arts and then changed to the health sciences. And I don't know that I would change everything that I learned along the way, from the failures to the successes and back and forth. But I think what I would change is that I wouldn't listen to people who said it can't be done. I think it is, the older I got, I learned to dream big, because if you don't dream it, it'll never happen. So I would say, go ahead, dream big, and try it out. You might actually surprise yourself and succeed.
Well, thank you, Abby. So you threw a question at us and we weren't prepared for one on it. So, I guess when I came out of high school, when I wanted to be with the dental insurance CEO, because I reflected on your question, I don't know if that would change much at all. As I came out of high school, there's accounting, I got an accounting degree, I have a CPA. I don't practice anymore, but I work hard for that certificate. So I keep it, like all my CE hours every year. But I think what it did was, I guess I went to the school where it was an extroverted accountant. The difference between the introverted and the extroverted accountant. The extroverted accountant was at your tutoring's mom, so you didn't set it no. But it opened my eyes to data and analysis and teams, Steve, that you had mentioned, in different organizations. And that's what's excited me. This is probably the fourth or fifth iteration of my career. Over 35 years, but actually today is my working anniversary through my organization. They reminded me this morning, and it's just been a great ride. The teams have made it happen, but the background that I had helped understand how things could be, not how they just are.
Well, there is little doubt that education and healthcare are significantly intertwined. As such, these sectors also share the challenge of keeping up with the continuous onslaught of technological advantages. So in this panel, our panelists are going to discuss different perspectives, and we've curated a panel of different perspectives to tie it all together and how it guides and talk about how technology can better position the triangle for a successful future in both industries. So starting off, as the triangle grows,
So does the need for growing both of these two areas, healthcare and education. So for the education side, Maha, how are institutions integrating emerging technologies like AI and virtual reality into traditional teaching methods? And why is that integration important? Well, that's a big question to start with, but I think we need to understand that technology needs to help support the learning of your providers. It cannot replace it, and the AI can help us just in general to hold our critical thinking skills, our communication skills, our and practical skills. And there are two examples. Traditionally, we would have our students interview actors or simulated patients, or we would have them, interview each other or the faculty member. But with AI, we can now create numerous cases where they can deal with it, where they can learn to deal with maybe difficult patients and learn that skill. But in addition to the communication skills and the critical thinking skills, there are also skills, hands-on skills. So, for example, we teach anatomy. We have our donor lab, and there are anatomy tables now. But with mixed reality, we can actually have students, walk around the big brain and maybe fold apart way to understand what is the vasculature to that part of the brain. Or our students need to practice invasive procedures. Let's just start with IV placement. And so we can practice that on people, which is not very comfortable. Or we can practice it on taskmasters or plastic arms, essentially. Or they can do that with technology now that they can repeat that procedure over and over again until they have mastery of that skill. So technology is just fantastic to augment what we have already.
Absolutely.
How are healthcare professionals, Steve, I'll throw this to you, how are healthcare professionals leveraging tech advancements to enhance efficiencies to patient care? And what areas are they seeing the most benefit from tech implementation?
Sure. So, first I'd say that, it's great to be in the triangle and it's great to be in the state from a healthcare perspective. So North Carolina is one of the leading states, in the nation in regards to just delivering high quality care. So number 2, pristine patient experience. Number 5, for leapfrog in regards to quality of patient safety. Money Magazine at North Carolina is a top 10 state in regard to affordability. So in spite of what you may read, that North Carolina is an expensive place, number 6 nationally in regards to cost per patient per year. So when we think about, the link between education and healthcare, it's been a link that has been, bonded for centuries, because every great discovery in healthcare has come from some learning. So, in healthcare right now, we're really focusing on 2 things that I think, really kind of use not only disruptive thinking, but applying technology. And those 2 things are recentering on the patient, just doing everything that we can to make patients and families and communities kind of center of the universe. And then it's leveraging technology. So from a recentering of a patient, it's all about quality outcomes. So hospitals and health systems are using AI and using data and analytics to do what we call predictive analytics on a patient. So we're able to get to where that patient may be before there is an issue. And, where we see that going is for, individuals in North Carolina, there are communities in North Carolina that have a high incident of stroke or a high incident of hypertension and high incident of diabetes, and it typically impacts, individuals of color or communities that are underserved the most. We're using that technology now to do, geo-tracking and sourcing. So we know what part of that community we need to apply resources to make them healthier. How people make appointments for seeing your healthcare provider and, we call a schedule. So we're all doing that. I mean, now we're moving to app-based appointments that enable new technologies to make it easier and more convenient for people to access their positions. And we know that by really focusing on consumerism and putting our patients, kind of at the center of everything we do, it's going to drive up experience. When we drive up experience, that means our workforce is happier, and it's going to cost less. So the healthcare costs less when people partner with their physicians and their healthcare professionals just to manage their chronic problems. We're focusing on that using technology to do that. Finally, in the enabling these, it's about how do we provide resources to workers to help them spend more time with the patient and less time kind of mining the computer. So one of the great things that EHR have done, the electronic health record, it helps us memorialize what's going on with that patient, share that much more easily and safely. The downside is that we're in a situation where sometimes we're mining the computer versus the others. And AI is helping us kind of liberate time away from the task at hand to applying that time to high value time, which is patient centered. We're also working to give patients the ability to manage their stuff. How many people have iWatches? Lots of people. And how many people have their iWatch that's enabled to take your pulse and your vital signs, and you're able to communicate with your physician. Well, that's like early adoption stuff. So we're working in the future where your provider team, everything that in healthcare is done by a team, will be able to kind of track you, work with you to help you optimize your health. And then finally, the predictive analytics piece is really interesting because we're going to be able to work with people before they're sick. And for those of us who have some member of our family that has some chronic disease, so show of hands. All right, we're going to be able to work with you before you even start having symptoms of that chronic disease and help, prevent them. So we're really excited. A lot of this is was discovery that's coming out of the academic institutions, and the list of best medical schools came out of today. North Carolina's medical school in that list. And I'm going to do a shout out to my friend Be Grateful. So, Murray School of Medicine, #1 in rural America. Lots of good things around the mix.
Curt, delving a little bit more into the tech space, Delta Dental utilizes technology to identify fraud, waste, and abuse, which contributes to which continues to be costly to the healthcare system and has been a concern for years. Can you talk more to those efforts?
Yeah, thank you, Abby. And before I do, just want to set a statement that at Delta Dental, we're a dental benefits dental insurance company, actually a nonprofit dental benefits company headquartered right here in Raleigh. Our mission is to improve oral health in the communities we serve, and our focus is by providing affordable access to care. Because if access to care is more affordable, more people are going to get care that they need. And that Steve, you even represented in your remarks. So I just want to set that stage that we do have the largest network of dentists. So we work with them here in the state as well as across the country. So we hear their voices, and that I'm going to bring the voice of that to this conversation as well as the work we do as an insurance provider. So if I could first, before we're probably to produce, one of the things I'm very excited about, and for Steve too, our great universities here across the state, we have actually 3 dental schools. The UNC Chapel Hill, East Carolina University School of Dental Medicine, and soon next month to open for the first class, Ivy League University Dental School. Just recently I visited all 3. And one of the things that I was amazed to see at Maha Lund had referenced this as well, is that sim labs. So I'm a pilot. Not that don't they remind us that you're if you're not done flying in the cockpit, when you get on, it's very hard to handle. But I do that for fun as a private pilot. So I had to practice become proficient to use the sinometer. So who knew that now in dentistry there are sim labs, simulators available. And actually at Ivy League University, they claim to have now the largest sim lab in the world. They're trying to have 20 simulators. So what it does is it provides the opportunity for their students to gain clinical proficiency through these simulation models before they go and actually deliver the care to a patient. I am told that through that particular simulator, they can actually feel the hardness of our tooth or the softness of the pulp that's inside your tooth as they provide that care. Better they practice on that than me, right? We're all about that. So anyway, that's technology that's coming to our dental schools here in North Carolina. From a business standpoint, you mentioned product waste and abuse. And certainly, we've all known about that in the healthcare system, whether it's medical, dental, or anything. What we're very excited about at Health Dental is we have our own internally developed claims processing system. So we do use AI in that. There was a lot of human involvement over the years. So over the past few years, we've developed such that if we receive claims electronically, we now are moving more to electronic records and things of that nature in healthcare. That if we receive those claims from the dentist electronically, 96% of them are dropped to pay without a human having to touch them. And then if the dentist signed up for electronic payment, we're paying them within 1 to 2 days. So that means we're now only having to touch 4% of the claims. Okay, so that's one efficiency. But now in product waste and abuse, we've just begun to use AI because when those claims do come in, we get x-rays, we get provider notes for some of the more costly procedures that may have. But we need to look at that and make sure, again, that the proper care has been delivered for the cost that we're paying on behalf of our clients, many of you that are here in this room. So think about it. We've got dozens and dozens of dentists looking at x-rays and records. You may not remember the x-ray that you looked at a week ago or a day ago or even a couple hours ago. With AI, we're going to put its fingerprint on each record. And what it just recently identified in a particular case was the exact same x-ray was being used by 11 different dentists in 6 different states for 10 different patients. We identified it with that x-ray of a dark web. So again, that fraudulent transaction tried to get in the system, which is increasing the cost of healthcare. And we want to do things to reduce the cost of healthcare so we can provide better access.
When I think of technologies, every industry is implementing new technologies, and it's not always the easiest thing to do. It's not always the right thing to do. Sometimes it feels that, shining Christmas present, but when you open it, it's not exactly what you wanted. Can you each tell us a little bit more about the primary challenges you face when implementing new technologies and what strategies have been successful to overcome them? Then we could go right to it.
Wow. So, I do think that the challenge of new technology, and we saw last Friday, kind of an upgrade that created a domino effect for industries throughout the country, and some of us here are those people that were affected by that. So I think that one of the challenges that we see in regards to adopting new technology is what are our contingency plans that are in place that we have to train people to do so that we can successfully maintain our core mission. So for healthcare, one of the interesting things to show you how old I am, when I was running the medical center in Greenville, we have to push to incorporate training into the education programs where they were adopting EHR, electronic health record, into their training. Now everyone that's trained is trained on EHR, but the backup plan for hospitals and health systems will be the paper chart. So I think one of the challenges that technology creates is just continuity planning. And how do you have a continuity plan that allows you to continue to deliver those key services and critical services that are necessary? I mean, hospitals can't delay flights. We can't delay admissions. So it's something that you have to, build, you have to rehearse, and then you have to practice. And then I think the other piece is that, technology and advancements change so quickly that it's, having an innovation plan for, every institution. So you're thinking ahead. It's like, we're using computer-aided learning, Chat GPT. How many people have used Chat GPT in the past 2 weeks? So a lot of people are afraid of it. But if we're not learning how to adopt that, build that into our innovation, and, we're going to be left behind. So I think it's innovating, keeping up and projecting the future. And then I think it's having that ironclad contingency plan that allows you to maintain your operation in the event of a failure.
I 100% agree that digital literacy is extremely important. I don't think that we should fear technology, but we should incorporate it into everything that we do. Going to the challenges, so I totally agree. The timeline, innovations come out so quickly that by the time we're implementing a new technology, there's already something bigger, better, faster out there. And so we need to be very diligent with identifying what is the next step. And then connected with that, we need to educate our teachers on these technologies. And often, since our students are so savvy, they're teaching each other. So it is really a collaboration. And then I think we should talk about costs. Like there are high startup costs, and then there are the current subscription fees per user, and that is often limiting what we can do and what we should be. And then as far as, how can we address these challenges, I think that we need to collaborate, and that is education and the clinical side. We need to know what the questions are in the clinic, and then figure out how can we prepare our learners to address those questions. So collaboration and communication are really big. So, correct.
Yeah, thank you, Abby. So challenges for technology. When we speak to dental providers, it's very clear what we hear, and even to our dental schools, funding. Plain and simple. Where's the money going to come from to fund these the research that needs to be done for what we don't even know is going to be available 5, 6, maybe 3 or 4 years out into the future as it relates to delivery of care. But when we talk to dentists, I would say, besides funding, now it's ROI. But it's not just about money. They begin first with saying, is it going to make me a better dentist? Am I going to be able to provide better care, more effective care, more quality care? Second, what's the impact for the patient? Again, do they get a better outcome? And is it more cost effective? And then third, it's going to tie down to that ROI. And certainly in the private industry, there's the employer market where companies like ours can fund, and we do fund our university research. I'll share a few of those examples, but it's also, we know how the public funds restricted. What we've done at Dental, we've created a Dental Research Institute that does provide funding to universities. I've got a long list, but I'll give you one or two. For example, at the University of Michigan, there's a intraoral tomography research that's being done instead of a 2 digital image, a 3D image, so that it can better diagnose the severity of a cavity or cracked tooth before making an invasive procedure. How much needs to be done, or how little needs to be done? Again, it relates to the cost of that care, but also the main goal is to retain that tooth, right? So you want to be able to retain that for as long as you can. Another area is research being done at Elon University that relates to the diagnosis of lesions. When an oral cancer is the fifth highest deadly cancer in America, but yet it's the most costly cancer in America. Think about oral cancer now, and it's the deadly. It's 50% don't survive that. But if you do, think of the reconstruction that needs to take place to talk, to chew, to smile, right? And things of that nature. So again, what can we do through these means to better identify lesions, whether or not it could be malignant? So those are just a few examples where the private sector is working with the public sector in our universities to help fund this research.
Steve, patient outcomes are paramount in healthcare. How does your association ensure that technological disruptions positively impact patient care and outcomes? And what metrics or feedback mechanisms do you use to elevate the effectiveness of those technologies?
Sure. So, I think, as I stated earlier, North Carolina leader of major outcomes. So that doesn't happen by accident. So it takes, intentional focus. So, if you think about the patient experience from start to finish, that's how easy is it to access, your care when you need it. So it's really about, figuring out, what's the best way to provide access to care, and then how do we keep track of patients as they, kind of work through the system to ensure they're getting the right care at the right time, the right place. So, hospitals and health systems, have adopted, several programs and adopted several technologies that allow providers to communicate with each other every time a patient has had an experience. So your primary care physician for those hospitals that have adopted this technology, that's both hospitals in the state, and North Carolina being one of the most rural states in the country, I think we're second behind Texas. There is a disconnect between what happens in a urban area like the Triangle area and what happens in Windsor and Berkeley County. But for those systems that have adopted these platforms, every time a patient is touched by the provider, a physician, a nurse, physical therapist, phlebotomist, all of that is coordinated with their primary care physician. So that individual knows, what that individual has gotten, and what's the next sequencing of care that person needs. And a lot of this is actually, feeding into what people call affordable care organizations, and those affordable care organizations, are incented to make sure that they're keeping people healthy. So I think access to care and access to tools where the medical community is helping people navigate the system so important. I mean, healthcare is super complicated to navigate. And for those of us who have elderly parents, it gives us a new appreciation for how complicated that is. We're working to try to break down those barriers, make that easier. The other piece we're working in and using technology is, to help make the pre-circuit pre-authorization process smoother. Because it's a big dissatisfier when patients have to wait to essentially have permission to get care. So we're working to use technology to speed up or alleviate that. So there's never a barrier to get the care that people need when they need it. And then finally, how many people like to get the EOB after you've had care that it says a lot of stuff, and it says this is not a bill, but everyone goes down to the bottom line that says this looks like a bill to me. So we're working to simplify that, to reduce sticker shock, because we never want a situation where people are hesitant to get care because they believe all of a sudden they're saddled with this immense bill. So we're working to make healthcare, more affordable. So it's start to finish. I mean, all of that process impacts patient experience. And one of the things that I love about North Carolina is we have hospitals. I mean, you can look out this window and see two hospitals that compete fiercely for patient loyalty. What we don't compete on is quality of care and looking for ways to improve the experience. So North Carolinians have the best access to care wherever they are. And of course, rural communities, telehealth, the lessons we learned during the pandemic were extraordinarily valuable in providing care to small communities that didn't have or don't have, access to subspecialty physicians. So those are all of the things we're kind of like, front to finish, really focusing on to make sure that North Carolina, one, has a reputation as the best place to receive care. But we're leaning into that reputation and actually doing that.
And Maha, what skills and competencies are you prioritizing within the school's curriculum to address new technology trends? And how is the school ensuring faculty have the necessary tools to deliver the related programs? That's on right, or on that. So there are so many projects and programs in place, but let me just kind of give you an overview of how important technology and AI is at Elon University. So let me start with President Book. She was, and let me, I don't want to misquote her, but She was part of the United Nations Internet Governance Forum in Kyoto in Japan last year, where educators came together and talked about how do we safely and reliably and ethically include AI in education. And those leaders came up with a statement that many presidents and chancellors have cited and many researchers. So that is number one. And then coming back home to the university, we have 2 centers where teachers can go to explore innovation and pedagogy. So we have the Center of Advanced Teaching and Learning and the Center of Engaged Learning, where teachers can ask, how do I do this? And there are experts there. In addition to that, we have had an AI working group for several years now. And just this year, we hired the director of AI implementation at Elon. And his responsibility and his team's responsibility will be to help people implement AI in the classroom, in pedagogical approaches, as well as in the administrative part. So we are working towards technology on all levels. At my home, the School of Health Sciences, we have added an interprofessional lab for VR, and that is part of our simulation center, and that was just fully accredited by the Society of Simulation and Healthcare. So technology, we can't get away from it, and we want to do it right.
Curt, data analytics is transforming healthcare delivery. How does your company use data-driven insights to tailor dental insurance plans and promote preventative care? And how do these insights contribute to better patient outcomes?
But thank you. You're speaking my language. Remember, I mentioned CPA, so data, right? Data drives all the decisions that we need to make. So I'm going to start off first, Steve, with an analogy you mentioned about the EOB on the medical side, from hospital or doctor visit, a medical doctor visit, in that bottom line. So when I came here to North Carolina 13 years ago, the bottom line on your EOB for dental insurance was too high. So North Carolinians are paying the 4th highest cost per capita for dental care in the United States. The flip side of what Steve just mentioned about medical care, where North Carolina's top of the list for more affordable. We were top of the list for less affordable. The benefit design plans here were not consenting people we use in that like that. Would you go to an out-of-network hospital or doctor or no care facility for your medical care? No. So why are North Carolinians doing this for their dental care? That's what's driven up this cost. So that's a message with data that we brought to the market. We got partners here in this room that represent employer groups all across the state that have taken the message to demonstrate the value of our market-leading network and how that can help reduce costs. The out-of-network costs here in North Carolina will pay dentists almost a retail price. How many of you buy a retail price for a car when you go shop for a car, right? That's what we were doing with dentistry. So that's the message we brought to the market with that data. It's resonating, such that many of you in this room, I know the mayor mentioned the city of Raleigh, city of Durham, and the city of Wake Forest. They weren't clients, they now are clients. Elon is a client of ours. So we've grown 2,200% at 13 years by bringing this message of affordability, not just from a cost perspective, from an access perspective, because if care is more affordable, people benefits last longer, and you don't get the care they need instead of putting it off, which creates more significant situations from the oral care, but as well as their medical care. So that's one way in which that we've used data to drive our decisions. And if I could end with this, something I'm very excited about. We just launched this in April. So data shows that 17% of North Carolinians have an intellectual disability, development disability. No one in this market was looking to provide benefits, I should say, from the insurance side, because it takes longer for the dentists. They need to be paid for. So we've just started a program for all of our clients that want to choose that at no additional cost in their rates, for one, to deliver that care to your dentist offices for those 70,000 individuals in North Carolina that have that special need. We're also providing free of charge to the dentists here in the state training the better capable to serve this special needs population. So again, using data to drive.
My last question, but I feel like we've only touched the tip of the iceberg today. There would be many more discussion points to have, but we're limited in time. So for the last question, I wanted to ask about equitable. How do we make all of this equitable? We talked about special needs. We're talking about rural communities. There are a lot of accessibility issues. What would be your priority for the next year to ensure that these gaps, particularly for underserved communities, can have the access they taking the one priority?
Right now in North Carolina, we had an equitable care committee of our board. So 4 years ago, our board said, we're not doing enough as a field to ensure that, our outcomes are equitable for everyone. Because we can do exactly the same thing for every patient. Once that patient gets home, then, we were not super good at kind of measuring what happened with that patient in regards to, the continuation of their care. So hospitals in North Carolina decided 4 years ago that we're going to collectively work at looking at improving and elevating, equitable outcomes for all people. And, that required us to kind of step back and say, hey, we're doing great compared to national, benchmarks. We're doing great compared to other states. But once we started really drilling down, looking at, outcomes for all North Carolinians, we recognize there's an opportunity to improve. And the areas that we're focusing on, are looking at, access to mental health services. We're looking at maternal health outcomes. We're looking at, how are we, educating patients at time of discharge and making sure they have access to continued support. I'm proud to say that all but one hospital in North Carolina, the 130 hospitals in North Carolina, state, federal, and, community hospitals, all but one are participating in this program. And what we're seeing, in the past 4 years, we're seeing gradual improvement in regards to, the clinical outcomes. The data and the analytics show that, these individuals are, being readmitted to the hospital less often. These individuals that are dealing with, mental health crisis are getting care earlier in the process. So the ED is not their default, which, if I were having a crisis, going to a place that's highly lighted, noisy, and there's a lot going on, would not be the kind of environment that I want to be in. So, I think, at least in the hospital space and the health system space, it required us to step back, really appreciate that, maybe we're not doing as good for all that we can. And it ties directly to, hospitals, missions and purpose, which is to, provide high quality care and provide high quality access and provide hope, for all people that come to our facility. So, we're just getting started, and, we're going to build on that. And, what I hope is that over the next year, we're going to see North Carolina continue to move forward when we look at how we compare to other states. We're the best in the Southeast, but that's a low bar. We just, be, a top 10 state and, it held outcomes for all.
I will be your one better. So obviously I look at it from the education point of view, and we teach our students to understand that AI is augmenting their decision capacities, and it's never replacing it. And so we're telling our students to look at AI recommendations with a very critical eye, because we have to remember that these algorithms that build the AI cases are built by people with biases, if unconscious or conscious biases. And so we bring case examples into the classroom and teach our students to be critical, because if we don't teach that while they're with us, then how do we expect them to recognize biases in themselves and in others when they go to them? And Curt, you're one of our
What have you done? Then we believe everyone deserves to help us file. That's not most, not just some of them this pro or someone across the street, but everyone. And there is a significant portion of our population that can't afford it. So when we started 12 years ago, you talked about one priority. We decided to focus on children. So 1/3 of the children entering kindergarten today have tooth headache. Tooth decay is the most chronic disease amongst children, yet it's preventable. So what can we do to change that trajectory? So 12 years ago here in North Carolina, we started a program called Smiles for Kids. What better place to start than with children? And so I'm proud to say that over the last 12 years, we've contributed almost $1 million. It's helped 510,000 children from Berkeley to Manio, as they say here in North Carolina, in underserved populations, but they don't have access to that care, to get that care. But we know an example of that here today. So I'm just going to turn to that for 30 seconds. Vivian with the Advanced Community Health Center, which is the FQHC, a very qualified health center, is one of our grantees here in our local community. We're Manio, right in Raleigh. And she just told me this morning how a grant we provided to her and her team helped 100 children here in our community that did not have access to oral care. Now I've been able to get that screening and that care. So thank you, Vivian. You're the one that makes it happen. We're just the ones that help provide that funding. So that's our focus as far as equitable care.
Well, Steve, Maha, Curt, thank you very much for your comment this morning. Let's give Panel 1 a round of applause.